Hello sir, good day. How are you feeling today?
Good.
So today I will be assisting you to do some range of motion exercise. Will that be okay for you?
Yes.
Firstly, we will start with the flexion and extension of the upper arm. And next, the abduction and adduction of the arm. And then the rotation of shoulders outward and also inward. Next is to do flexion and extension of the elbow. And we do also the supination and pronation. Next is the wrist. First, we start with the flexion and extension of the wrist and also hyperextension. Radial and ulnar flexion. Next is to do abduction and adduction of the thumb. And also flexion and extension of the thumb. After that, we do opposition from the thumb with the little finger. Then, we work with each finger by doing abduction and adduction. And lastly, flexion and extension of the fingers. For the leg, we start by removing one side of the blanket. Firstly is the flexion and extension of the leg. Next is the abduction and adduction of the leg. Then, outward and inward rotation of the leg. Next is the knee flexion and extension. Then is to do the plantar flexion and dorsal flexion. After that is the inward and outward rotation. Next, we move on to the toes, where we first do the abduction and adduction of each toes. And lastly, the flexion and extension of toes. And then, we repeat the same procedures on the other leg. After finishing the procedures, cover back the patient's leg with the blanket and make sure they are comfortable.